Aloha, Professor. How are you? I apologize for the inconvenience and the little mix-up there. Uh, for the topic that I'm choosing for this assignment, you want me to demonstrate something that I do on a daily basis. Being a medic, this isn't something that I get to do on a daily basis, but it's something that I'm highly trained in. And for that aspect, I kind of like to share it to you, especially since there may be an environment or even a situation where you're placed in that you may or may not be able to utilize the skill that I'm going to teach you. The skill I'm going to teach you is how to use what we call a CAT. This is called a Combat Application Tourniquet. Essentially, all it is a very long strap with a windlass on it. The windlass itself is to allow for pressure, and the strap itself secures around a limb. As you can tell, very long. The reason why I want to teach you about the tourniquet is just because there's been a lot of instances recently where my skill set is utilized in mass casualties. When you think of a mass casualty, you're thinking a lot of people in one scenario, and that's not necessarily the case. What is considered a mass casualty is when the medical supplies of the arriving unit are far exceeded by the number of patients. A mass casualty could easily be 2 to 3 people, dependent upon the scenario and dependent upon the service that is going out to provide that coverage to the area. The reason why I want to present this is a skill set that I'm highly trained in, and if done properly, not only can you save an extremity, but you can also save somebody's life. When somebody's getting shot or somebody gets stabbed or something happens, there's always a way to respond to that scenario. And a lot of people don't know how to respond to those scenarios. And that's what my job is. My job is to help inform you, but also help train people to be able to utilize these skill sets in the vast circumstances that they're put in. And I want to make sure that they're done safely. Improper application of a tourniquet is the worst thing that could possibly happen. There's many things that could come from it, one of the worst being compartment syndrome. Compartment syndrome is when you have a buildup or an air pocket in a muscle that causes the muscle to deteriorate. Once you start deteriorating that muscle, it's not coming back, and there could be a possibility of limb loss. Nobody wants that. It's highly frowned upon, and I'm pretty sure everybody would like to do the normal things they can do with their families. So for my assignment, I'm going to revise the original thing that I had submitted to you because I made some little typos in there, and I apologize for that mix-up again. It's been happening quite frequently. I promise you, it's not a blonde mimic. It's my old timers kicking in. But I'm going to help educate you on what the proper use of the tourniquet is, where you would use the tourniquet, why you would use the tourniquet, and what the applications are for the tourniquet. There's a lot of things that are very beneficial for it, and ironically, there's a lot of history from the clinic I work at to the current use of what these tourniquets are for. So it's going to be kind of cool how I can incorporate the two and two and just kind of show you not only why they were important, but why they're beneficial for today's use and what the common misconceptions of tourniquets are. So I look forward to presenting this to you, and I look forward to being able to hopefully help somebody else that may or may not know how to utilize these sources, and hopefully help you to help somebody else to possibly save a life in the future. And I'll provide resources as well to find videos that are good to be able to access to this. I hope all is well. Thank you for watching. Take care, Professor, and I look forward to class.